This is Michelle from Physioactive Indonesia. Today we will be addressing a common concern and inquiry amongst many parents residing in Indonesia, the flat foot in children. We know that majority of children between 1 and 5 years of age have flat foot and could potentially outgrow this and develop a normal arch. So when does this condition become of concern? I would like to introduce you to Ms. Helen Crawford, Podiatrist at the Osteopathy and Podiatry Center, Singapore, to get her views on this matter. How are you, Helen?
I'm great, thanks. How are you?
We're doing well, thank you. So podiatrists are medical specialists who help with problems that affect the feet and lower legs. Podiatry is a great field that really blends well with the conservative rehabilitation setting. Sometimes surgery is necessary, but really working with a podiatrist in conjunction with a physiotherapist can help in managing some conditions that don't warrant immediate surgery. Helen, let's start with a brief introduction. Can you tell us about your qualifications and experiences, please?
Yes, I trained in England, in London, and I started working in the UK. I worked there for 6 years before coming out to Singapore. I started off full-time at SGH, and then after that, I basically did a lot of consultancy work and set up some departments in a lot of the other government hospitals that were around then. So I think practically all but Tan Tock Seng I worked in until the new ones obviously opened more recently. And then I also part-time started up a private practice, and now I no longer work in the government hospitals.
Can you explain what pediatric flat feet is and how can a parent identify flat feet in children? And when is it too early or the right age to consider treatment?
Okay, so everybody's very concerned about flat foot. It doesn't have to cause a problem. We see children from as young as 18 months old. Our clinic deals with a lot of children. We work very closely with a school shoe company here as well. Really, parents often bring their children in when there's a problem, if there's pain, if they're tripping and falling, if they're complaining when they're walking, they're tired, they're clumsy. But some parents bring their children in because as parents themselves, they have foot problems, or there's a genetic history of foot problems or knee problems or back problems, because they can actually be associated with the flat foot. So we do screening. Some parents just want us to screen their children. There may be nothing wrong with them. So we'll just do a full assessment and give them the picture of what's going on. So it's never too early, it's never too late. But what drives people often is they'll get advice from friends or they see other people. The shoe shops will sometimes recommend them.
It is not definite that they have to meet an orthopedic first before consulting a podiatrist?
No, it's not necessary. I mean, a fair few of our referrals do come from orthopedic doctors, but it's not necessary. We get a lot of referrals from word of mouth, from physiotherapists, from other osteopaths, a lot of different referral sources. You don't need a doctor's referral to come and see us.
And what are the characteristics of a flat foot that requires this attention?
I think requirement to see someone is if they have problems, but if they just see themselves, like if they look at the child is standing and the arch is touching the floor, or it's very low to the floor, then that's an indication where they might want to get it screened and checked out.
Okay. And what is the procedure? What is the process that one can expect when they come to the podiatrist?
Okay, so in our clinic, because every clinic's different, when the child comes in, we'll take a full medical, social birth history. So we'll find out whether they were premature, what age they started walking, what activities they do, what footwear they have, if parents or grandparents have any foot, knee, back problems. And from them, we'll do the physical examination. We don't take x-rays because we feel it's not necessary, because you can see if a child's got a flat foot by looking at them. So we'll do a static examination. So we'll stand them up, we'll do some tests on their muscles and on their strength and look at the foot posture. And then we'll lie them down and check their range of motions of their joints and some of their strengths. And then we'll do a gait analysis. And then from that, we'll bring it all together as to whether they need monitoring, whether they just need new shoes, whether they need physiotherapy referral, or whether they actually need some custom-made insoles or orthotics.
Okay, so in the case if they do need insoles, and children they have the tendency to grow out of their shoes really quickly. How does that work for patients that come in from Indonesia?
So the insoles in children will normally last a year to 18 months. They can go like a size, sometimes a size and a half up. So like if children are here and they're younger than 6, we would normally see them every 6 months. If they're older than 6, we normally check them once a year. So it's not like they have to be coming regularly like braces where you adjust them every month. It's a less frequent problem.
All right. And do you have any other information to share for Indonesian patients that require podiatry?
The first appointment, they should be aware that we do a 3-dimensional scan of the foot. We will write a custom prescription for the child or the adult. And what we rely on is our assessment, also the weight, the age, the activity, and the footwear of the patient. So it's very, very customized to what that patient does and who they are as a person. And that has to go to our lab in Australia. So it usually takes 2 weeks to get made. They can do a rapid return and we can get it back in a week. But for the first appointment and the first pair of insoles, we like the patient to be here to do the fitting. So they might want to plan that they need about 10 days here. When it's like their second or third or fourth pairs, we're not so worried. We can actually courier the insoles to them in Indonesia. And then if there's a problem with the wearing in or getting used to them, then they can come for a follow-up later. But usually there isn't any problems.
All right. And would you like to share with us an experience in the case of pediatric podiatry?
I had one quite recently, actually. I had this boy who was about 11. He was very, very active, did lots of sport, but he was having a lot of problems with his knees, as well as a little bit of problem around his inside of his ankle. And, he was not going to give up the sport. Mum was very worried because he was in a lot of pain. And he got his insoles and everything disappeared. He was able to continue. So Mum was really happy. And when we get reports like that, it's really nice that, to hear that my son can now join in everything. He has no more pain. And, she actually said to me in the email, I wish I'd brought him in earlier. I didn't know I could bring him to you. I mean, often the parents don't know that knee problems are associated with the feet. So that was really nice to hear.
That's nice. Wow. That's nice. Well, thank you so much for the information. And it was nice speaking to you. For our viewers, if you're interested in speaking with Ms. Crawford, you can call +65 6734 4236 or visit their website at www.osteopathy-podiatry.com for more details. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in. If you are looking for podiatry services in Jakarta, Physioactive Indonesia can help you with an initial assessment and connect you with Helen Crawford.